SAGE-718 is an investigational compound. It's an oral molecule and works by modulating the NMDA receptor. It is a positive allosteric modulator of the NMDA receptor, and this is a new mechanism that actually has not been employed or deployed by any other drug that's on the market. We've done a number of work in neurodegenerative diseases to demonstrate that there is a relative NMDA deficit or hypofunction early in the course of neurodegenerative diseases like Alzheimer's disease. And our belief is that by treating with a drug like SAGE-718, we actually may be able to restore NMDA tone, thereby improving patients' cognitive symptoms, which has borne out in some of our early work completed to date.